I am Frits Broekhuizen. I'm on the board of Physicians of Reproductive Health, and I have for many years been an advocate for reproductive rights. And I have provided abortions for 4 to 5 decades. I first became alarmed by what I saw when I was a tropical doctor in Africa, where I saw many patients with infections and other bad consequences of unsafe abortion. So it took me very early in my career, not too long, to come to the conclusion that abortion needed to be safe. Later in my career, I became a maternal fetal medicine specialist, and actually that seems to be somewhat in conflict with abortions, but I ended up specializing very much in taking care of medically indicated pregnancy terminations in the institutions I worked, for severe maternal disease and for lethal fetal anomalies. I can tell you that I got more Christmas cards from very thankful patients that I did that for. I've practiced most of my career in Wisconsin, and the climate there in the last 3 decades has deteriorated, and one of the few things that I can do besides providing abortions at the Planned Parenthood clinic is to give testimony at legislative hearings to make sure that abortion remains accessible. And that has been somewhat of a struggle, especially if we want to make it accessible and affordable for patients on the lower income scale. And I've been for many years an advocate of improving healthcare for the underserved and the patients who are on Medicaid and often have no coverage for that. And as a medical director of Planned Parenthood, I have always felt very good about going to hearings to try to educate legislators, even while that is not an easy task. I think the struggle that we have is still more difficult now than it was 40 years ago to maintain and preserve reproductive rights of women.